Well, it happens to be officially summer now, and we know that that is happening because the mosquitoes are biting. It's so painful out there, and they are everywhere. With how to keep your skin protected and treat those bad bug bites is Dr. Rodrigo Hasbun joining us live, an infectious disease specialist with UT Health. Welcome to Houston's Morning Show. It seems like mosquitoes are worse this year than ever. Is that the case, or does it just seem that way?
Yeah, there's definitely a lot of mosquitoes because of all the rain and humidity we've been experiencing. So we got to be very careful with mosquito bites this season.
Now, besides them just being pesky, we're a little concerned about everyone's health, especially with problems like West Nile. How do you feel how big of a concern, I guess, would that be in our area and other bloodborne illnesses from mosquitoes?
Well, we already have West Nile in mosquito and birds in the Houston area. So this is prime time to get bitten by a mosquito that has West Nile and get West Nile. So you got to be careful and try to avoid mosquito bites as much as possible. There's already cases in other states with West Nile already.
And sometimes that can be easier said than done to stay away from them. Can you give us some ideas and just keep it fresh in everyone's minds, the best way to protect yourself from diseases like West Nile?
Sure. So the best thing is to try to avoid mosquito bites. You need to get rid of standing water around your home, use repellent, try to go outside, not during the dusk and dawn times where the peak activity of mosquitoes is. And if you're going to go outside, try to use long shirt sleeves and pants as well, and try to use DEET in your clothes and also in your skin.
And it seems like there's always that person in the group that gets more of them than usual. Why, so many people question that. But for those people especially, sometimes the bumps can even be more swollen. What do you suggest to anybody, though, who is trying to heal those without itching too much or scratching it too much?
Well, you can put some topical hydrocortisone to alleviate the itching and take some Benadryl if it's severe enough. But usually they go away within less than a day or so. But the most worrisome thing is the diseases they transmit.
Well, hopefully in best case scenario, if you do get bitten by a mosquito, it just ends up being a pesky, itchy bite. But let's talk about if it does turn into something worse. What would West Nile look like? Could you kind of walk us through those symptoms so that people can know
Sure.
what to expect from that?
So the incubation period is usually 1 to 2 weeks. And a lot of patients don't have any symptoms, but 20% of them are going to have fever, such as like flu-like symptoms, and 1 out of 150 are going to have what we call neuroinvasive disease. That basically means either meningitis, severe headaches with fever and photophobia and nausea, or even a brain infection called encephalitis, or an infection of the spinal cord called myelitis, where patients can have paralysis of one limb or be completely confused and altered and need to be admitted to the hospital.
Now, when you talk about symptoms like that, obviously that would be a sign that you need to get medical help immediately. But how do you know when it's time to go see a doctor? Because it sounds like those first symptoms you said for the milder cases, it's going to be really confusing about what's going on with you. And I would think in this day and time, someone might even be concerned that they might have COVID. It sounds like they really cross those lines of a lot of common symptoms.
Exactly. So what we call West Nile fever is basically those patients that have fever after a bite. It could be anything. So you need to be tested in order to know what's causing them. If you have meningitis or encephalitis, that's definitely more serious. And those patients need to go to the hospital and be admitted and get tested as well.
So is there a simple test to find out if you have West Nile, or does it just go by the symptoms and a doctor looks and checks off the boxes of, okay, this is probably what it is, or can you have a definite diagnosis?
You can have a definite diagnosis by a blood test. So for West Nile, we do what we call serology or antibodies, and we're looking for the West Nile IgM to be positive. If you come in with a West Nile symptom, fever, meningitis, or encephalitis, and the IgM is positive, it's confirmed case.
All right, Dr. Hasbun, hopefully with the advice you gave us of how to protect ourselves, we never get to that last part of this conversation, but it's good to know just in case. Thank you for your time today from UT Health.
More than welcome.
Have a great day.